Really big excitement.
Another crutch, if you will, um, is the knee brace. I see a lot of folks will sit there and they initially, maybe there's an injury or something acute, or maybe there's not, but they put a knee brace on and they feel more stable, they feel more in control. Their knee doesn't hurt as much, and so as a result, now every time they come to the gym, they're wearing the same knee brace. Um,
Yeah.
and of course, I'm a personal trainer, and I look at the human body and I say, well, if you don't put the human body under some stress, it will get weaker, not
Right.
stronger. And so you do have to find that appropriate hormetic effect stress, so
Mhm.
things can improve. But is that the case with knee braces? Is that just something we should
Yeah, you're
self
asking
medicate?
such a fantastic question, because there's, again, like a lot of the questions, and again with my patients, there are so many layers of answers, right? So you kind of start with the gross answer, like, is your knee really unstable, right? So you can check the ligaments. You can say, oh, the MCL, the ACL, the LCL, the posterior cruciate ligament, they're all working perfectly. So is the brace creating stability vis-a-vis the ligaments? And the answer would be no, right? Is the kneecap coming out of place? Well, if the kneecap is coming out of place, there are braces that help keep the kneecap in. Well, that would be an answer for a specific question. Again, very
Yeah,
personalized, getting back to personalized medicine.
yeah,
Other people have issues that, they have a little tiny bit of arthritis, maybe they have an inflammatory process, their knee is sore all the time, a little bit, and they get stiff after the soreness. But if they put a compressive brace on of some type that's neoprene foam, it makes the knee warmer. And just like hot yoga, if the knee is slightly warmer, even a degree or two warmer, it'll be a little more flexible. It'll feel a little better. So some people, it's a thermal effect. You have some kind of brace that keeps the knee warmer and they feel better. Other people, it's a mechanical issue. And there's a third group of people, and aside from the injuries, we can talk about injuries another separate, but third group of people where the brace itself serves as a funny reminder, almost like tying that ribbon around your finger, right? So if they know that they get into certain ranges and they have knee pain because their kneecap is worn on the superior pole, the inferior pole, or the lateral edge of the kneecap is worn or whatever, and there's a certain range that gets them in trouble, and they put that brace on that inhibits them slightly, they don't get into trouble, right? So that would be another way of using the brace to stop that motion that gets into trouble, or remind them not to go there. And then that may be a benefit in and of itself, because then they can exercise and feel comfortable exercise, but they're not going to go to a place that's going to hurt them. And the last little piece of that is proprioception. And I'm sure you're familiar with the concept where, you can
yeah,
close your eyes and touch your nose, just do that. And you know where your nose is, you know where your finger is very well. Um, you know where your knee is pretty well, but sometimes as we get a little older, maybe your reaction time's a little slower. Maybe your ability to really tell where your knee is. Maybe you're losing proprioception because you have a little spinal cord issue, and there's a herniated disc that gives you a little trouble, and you don't really realize it's affecting proprioception more than anything. And you put the braces on, and you feel your knees moving, and you have a better sense of where they are in space, and you feel more comfortable doing whatever you're going to do because you know better where your knees are. That's a very complicated idea for a lot of people, but the GPS thing kind of brings it home. Like,
yeah,
I close my eyes, I know where my knees are. Now, if you tear your ACL has stretch fibers in it. Some people lose the proprioception in their knee when they tear their ACL, and they feel gorky and uneven, even when you reconstruct it. And we talk about that after reconstruction, for another year, people have apprehension when they play. And
yeah.
there's actually a re-injury rate of that knee and the contralateral knee, the other knee, when you don't know where your knee is in space and you make a funny move. And there's some data saying now, like, if I brace you, even though you don't need it, and your ACL is good and the stability is good and the reconstruction went well and your meniscus is healed, and I use a brace for that next year, return to sport, it's not really protecting the ACL so much. It's giving me that little extra confidence and a little better proprioception, so I don't hurt the other knee or re-hurt this one. And for some people, that is golden. That makes all the difference in the world. They're not as tentative. I have so many stories of people who cut to the right, cut to the right, cut to the right, have a right ACL. Next year, they come back, they go to full out sports, and a year later, they come back with the left one, the same exact injury, doing the same maneuver the other direction, you know?
Yeah.
So they, there is some value in that little bit of extra security that the brace might give you, even though scientifically it doesn't really react fast enough to really protect the knee in the way you think it might, but it may have other benefits we really can't measure.